Our next presenter is Chen, a professor in the Department of Biomedical Engineering in the McKelvey School, as well as in the Department of Radiation Oncology in the School of Medicine. Professor Chen's presentation is titled, right there. Please help me, please welcome Professor Chen.
Okay. So we all know ultrasound as an imaging tool, and especially for viewing the fetus during pregnancy. So today, I brought with me a focused ultrasound device made in the lab. And my goal today is to convince you that sound waves can have the power to defeat brain diseases that affect many of us and our families. So just like a magnifying glass that can focus light on a small spot, this focused ultrasound device can concentrate sound waves on a spot as small as a grain of rice. Focused ultrasound can penetrate through the skull and focus at the diseased brain location without affecting surrounding healthy tissue. And this is the only available technology that has the combined advantages of no incision, no ionizing radiation, deep penetration, and high spatial precision. So such a powerful tool has many potential medical applications. And our group focused on using this tool to overcome the blood-brain barrier. So the blood-brain barrier is our brain's first line of defense that separates the circulating blood and the brain. And it keeps our brain safe from harmful substances that may present in your blood. So for example, if you catch the flu virus won't be able to invade and attack your brain. Unfortunately, it also prevents more than 98% of available drugs from reaching the brain and presenting the major challenge for the treatment of most brain diseases. What can we do? So we can use focused ultrasound to open these gates in a controlled way, so drugs can pass in through the barrier. Here's how it works. So patients are injected with microbubbles, and these tiny bubbles can circulate in our blood circulation just like red blood cells. And when they reach the focused ultrasound targeted brain area, they are popped by ultrasound, generating gentle forces on the barrier surrounding the blood vessel, leading to the opening of the barrier for a few hours before sealing itself again. So this technique has been investigated for more than 1 decade with clinical trials currently ongoing for patients with glioblastoma and Alzheimer's disease. So our lab chose to work on using this technique for the treatment of the most deadly pediatric cancer, diffuse intrinsic pontine glioma, or DIPG. So kids with DIPG has a survival rate of almost 0 and a median survival of only 9 months. And we desperately need new treatment or new technology for the treatment of this disease. However, there are 2 main challenges. First, the tumor occurs at the pons. It controls vital life functions such as breathing and heartbeat. So surgery doesn't work. We need non-invasive techniques. Second, the blood-brain barrier, for DIPG, the blood-brain barrier is almost intact with reduced permeability compared with all other brain tumors. What are the good news? So the good news is focused ultrasound maybe have the potential to overcome both challenges. As demonstrated here, these are PET-CT scans of a mouse without focused ultrasound treatment and with focused ultrasound treatment. Without focused ultrasound treatment, we don't see any drug get into the brain because of the blood-brain barrier. And with focused ultrasound, we achieved localized delivery of the drug precisely at the pons. So as my 8-year-old daughter said, this is awesome. So now you know we can use sound waves to deliver drugs to the brain. Can we also use it to diagnose brain diseases? So currently, invasive tissue biopsies are normally performed for brain cancer diagnosis. As you can already see, this procedure is very invasive, carries significant risk. Genetic testing offers a non-invasive approach for disease diagnosis. And you can test your DNA by ordering a kit from Amazon for just $99. So can we do a DNA testing of our brain tumor? It doesn't work. Why? Guess why? The blood-brain barrier. So one of the challenges, DNA released from brain tumors are blocked by the blood-brain barrier. So we propose that focused ultrasound can enable two-way transfer across the blood-brain barrier. So drugs in the blood circulation can be delivered from the blood to the brain for the treatment of brain tumor. And tumor-specific DNA, RNA, and other markers can also be released from the brain to the blood circulation, enabling the diagnosis of brain tumor through a blood test, or called liquid biopsy. So our lab introduced the focused ultrasound-enabled liquid biopsy technique for the non-invasive diagnosis of brain tumor. We also obtained amazing data in animal studies, as shown here. With focused ultrasound, we enhanced the amount of tumor MRA by 3 orders of magnitude in the blood. Okay, to sum up, we demonstrated that focused ultrasound can enable two-way transfer across the blood-brain barrier for the treatment and diagnosis of brain tumor. And we hope we can also expand the application of the technique to other diseases in the brain. So all our work is built on the existing strong two-way connections between the McKelvey School of Engineering and our School of Medicine. And every day what I'm doing is two-way transfer across both campuses. So we are going to continue build the momentum in ultrasound innovation in collaboration with faculties across both campuses. Thank you.